Okay, everyone. Welcome to our public hearing on November the 9th, 2001. Welcome, everyone, and visitors are invited to join the board in rising for the Pledge of Allegiance, please. I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call. Councilwoman Freeman.
Present.
Councilman Perdicone.
Here.
Councilwoman Romeo.
Here.
Councilman Weiner.
Here.
An attorney for the town.
Here. A couple of announcements. First of all, the masks are required. It's a policy we've had since August for the health and safety of others. So there is a box over there of masks. I'd appreciate it if all would put them on as they're in here, just for the safety of all. A couple of things that we will talk about. First and foremost, the town board has not made a decision. We're here to listen to all our residents, and on behalf, I appreciate we have a room full. Thank you all for coming. If you have any written testimony, if you come up with written testimony after you're done, could you give it to the clerk, Barb, please? And we are here for a hearing on the proposed law to opt out of the marijuana retail dispensaries and/or cannabis on-site consumption business within the town. We have a large number of people signed up to speak, and it appears there are even more people in the audience. To ensure that everyone who wishes to testify has a chance to speak, I want to establish just a few ground rules for the hearing, please. Before testifying, please state your name and your address for the record. The purpose of the hearing is to receive feedback on the proposed law. Please limit your testimony to the proposed law. To ensure that everyone gets a chance to be heard, we will limit testimony to 5 minutes per speaker. Please be courteous to your neighbors and limit your comments to 5 minutes. Witnesses will be called in order shown on the sign-in sheet. Please do not interrupt your neighbors, but instead wait for your turn to speak. Please wait until given the floor before speaking. The purpose of the hearing is to receive your feedback. Please do not interrupt your neighbors, and please direct your statements to the town board. No person may speak a second time until every person who wishes to be heard has spoken. The town board is here to listen to your feedback, not necessarily to express its own views or opinions or debate questions. If you are in favor or opposed of the proposed law, please tell us with your reasons why. Should your statements exceed 5 minutes, we ask that you submit your comments in writing and enter them into the record. So I'll read the names that are on this list. When everyone's done, if someone didn't sign in but you'd like to come up and speak, feel free after I go through the list, okay? And then, you're more than welcome to come up. So we will start off with Jill Gruber. Jill? Okay, is it Adams? Yeah, come on up. Is it?
It's Aisa.
Okay. Just state your name and your address, please.
So my name is Aisa Adams, and I currently reside at 73 Northfield Road. Specifically, I am pro-marijuana, pro-cannabis. Honestly, I've lived in Irondequoit since 1998. At this point in time, our property taxes have gone up extremely. Our school taxes have gone up extremely. And I feel bringing dispensaries and different cannabis-related businesses in our neighborhoods will help reduce the taxes that we are paying. I've looked over different states that actually have, or in different towns that actually have cannabis-related businesses and what they've done for the residents there, specifically bringing in revenue, bringing in tourists to the area. Irondequoit no longer has a mall. We have a rec center that has not opened, that's been sitting empty for years. And people my age, I'm 33, and there's nothing to really do but go out and drink. Alcohol is one of the most dangerous substances that is legal. And there's a bar literally maybe a mile or less from the school. It opens early, but a lot of people won't allow cannabis in the community, which makes no sense to me at all. Most cannabis users are really nice people. We are regular people. So bringing it to this community, I think would be best, just to allow us the best revenue possible. Give some of the residents something to do, get out and meet people, and finally get a chance to educate yourself on what cannabis is and what the revenue could be brought to this town. That's all I really have to say.
Okay, thank you.
You're welcome.
Thank you.
Stephen Vanderwall? Stephen, come on up, please. Did I say that right? Okay, good. You'll say it better than me, right?
Well, thanks for having me. My name is Steve Vanderwall, and I'm actually a small business owner from 13 Hickory Pond Drive in Penfield. And I'm here tonight as a cannabis industry advocate to encourage the town of Irondequoit not to opt out of allowing retail and on-site consumption lounges. Because to be honest with you, it doesn't really make any sense to opt out. While retail and on-site lounges would be prohibited, other cannabis businesses are still able to operate within the municipality. That means that cultivation facilities, manufacturers, distributors, cooperatives, etc., can all still operate here. And even though dispensaries and lounges will be banned, it is still perfectly legal to possess and consume cannabis wherever tobacco is permitted. That just means residents will drive to the next town over, purchase cannabis, and drive back to their homes to consume it, with all the tax revenue going to that municipality and none of it going to this one. I understand that there are people in this room who have reservations regarding legal cannabis. I totally get it. 80 years of reefer madness and misinformation is a really tough thing to combat. But I can assure you that prohibiting retail and on-site consumption is not the answer. People deserve access to high-quality, safe cannabis in their hometowns. Small businesses deserve the opportunity to set up shop in their hometown. And the residents of this town deserve the opportunity to reap the financial benefits from the tax revenue that this industry will ultimately generate. Now, with that being said, I'd like to offer myself as an expert resource to the town of Irondequoit to address any concerns or questions you may have regarding the issue. I'm not tied to any political organization, nor do I have any plans of setting up a dispensary or on-site consumption lounge in the town. I'm just someone who understands the profound economic benefits that opting in can bring the communities that allow it. So thank you for your time.
Stephen, thank you. Rachel?
Hi, Rachel Partington. I reside at 265 Spencer Road, Irondequoit. So good evening, councilmen and councilwomen, supervisor. I want to start by thanking you for holding this public hearing today. I'm a resident here in Irondequoit, and professionally, I'm a municipal land use and environmental attorney with Knopf Shaw LLP, and I also work with a real estate brokerage, Park Jordan. Additionally, I'm social media co-chair for the New York State Bar Association's Environmental and Energy Law section. I began my career as a municipal and land use consultant at the Pace Land Use Law Center while attending Pace Law School. At this time, New York passed its medical marijuana program, and I spent a great deal of my time learning about the plant, its medicinal benefits, and how to safely roll out dispensaries. I did this through my work with the center's mayoral and corporation council roundtables, advising municipalities in the Mid-Hudson and Westchester regions. Flash forward to today, and I've represented municipalities, including Sodus and Huron, among others, and I understand the need for regulations and thoughtful, well-informed decision-making. I've been involved with passing moratoria on hydraulic fracturing, waste-to-energy systems, and even solar production systems. These were complex or newly developed activities that are distinct from the two activities we're considering today: retail dispensaries and on-site consumption lounges. So to summarize quickly, I am not for opting out. In my training that I've done for municipalities and organizations such as MCBA's environmental and local government committees, I've found it's crucial to first understand what these two uses look like, because they already exist in other states. These are highly regulated, expensive operations requiring a budget of $250,000 to $2 million to even open doors. They are not to be confused with head shops. Although we have yet to see the regs on these operations, we know that there are already requirements in the MRTA to monitor the location, security, and potential for odor from these businesses. Now, this is something you can look up to learn more about. I'm sure a lot of you have been doing that, but I want to reiterate again, these are not head shop types of operations. I see no reason to opt out of these uses, which in my opinion will be less complicated and have less environmental impact than cultivation and processing facilities, which you can't opt out of, and we don't have the regs on those either. As a land use professional, I've been most excited about their potential to increase municipalities' tax revenues and place underutilized and abandoned properties back on the tax rolls. I had a great conversation with the Department of State's local government office yesterday about these benefits, and specifically in Massachusetts, right next to us. Research is even starting to show that dispensaries have increased property values long-term and not lower them. Again, this is not like a bar or a liquor store. I think that as a diverse, affordable, and community-driven town, we need to be careful of the message we are sending here. I have full faith that our regulators will deliver safe, strict standards to these operations. I've spoken with the Cannabis Control Board Chair, Tremaine Wright, and even had her speak at an event I co-organized at Comedy at the Carlson last month, where she went through each aspect of the MRTA and considerations for regs diligently with our audience. In light of the tremendous work that the state is doing to ensure safe operations, I'm concerned that needlessly opting out sends a message that we are against cannabis outright. This is a stigma I've struggled with, along with many others, and predominantly in communities of color in lower income areas. I, perhaps like some of you, actually used to be afraid of cannabis. I was told, like many, that it was a gateway drug, which has been disproven. This changed when I was diagnosed with multiple autoimmune conditions and suffered permanent nerve damage to my hearing and nervous system. If it wasn't for doctors safely advising me on how to use this product that I could get at dispensaries, medical and adult use, I would not have made it through law school, and I would not be standing here today. Literally, one of the most significant challenges with my condition is my ability to maintain an upright posture without experiencing serious fluctuations in my vitals. Cannabis has actually regulated my vitals and significantly decreased my pain levels. Again, I'm so appreciative of you opening the floor to residents, and I urge you to consider the consequences of this opt-out. Thank you.
Thank you. Mary Kruger?
Mary Kruger, 29 Gregory Street, Rochester, New York, and I grew up for 29 years at 2608 St. Paul Boulevard. So good evening, my name is Mary Kruger. I'm an alumni of West Irondequoit and the founder and executive director of Rock Normal. We're the Rochester affiliate of the National Organization for the Reform of Marijuana Laws, a nonprofit cannabis consumer advocacy organization. I'm here tonight to advocate on behalf of cannabis consumers in Irondequoit in hopes that you will vote no on opting out. Opting out doesn't mean you're going to keep cannabis out of your community, because the reality is unregulated cannabis is already in your community. After spending the last several years on grassroots lobbying efforts, we've been able to educate our elected officials on reefer madness era myths and put more realistic concerns to rest. I'm sure some of your concerns related to legalization are similar to those that we've heard from others, so I'm hoping the information I'm going to share with you will help put these concerns to rest for you too. When we look at states that have already legalized adult use cannabis, we have not seen an increase in youth use. Instead, in some states like Colorado and Oregon, we've actually seen a decrease in youth use, as published in a study in the Journal of American Medical Association. This can be attributed to having more accurate education for youth about cannabis consumption and to having more barriers in place to access regulated cannabis, like requiring ID for purchase. Of course, the introduction of regulated cannabis doesn't immediately eradicate the unregulated industry, but it is a step in the right direction when taking a harm reduction approach, because we know kids are already consuming cannabis. So we want to do everything we can to put measures in place to stop that from happening, which means having regulated cannabis. Related to harm reduction and the concern of the opioid epidemic, according to several studies published, there is a direct correlation to marijuana access and a reduction in opioid use. In one study published by the Journal of Addictive Diseases, they found 93% of participants decreased or stopped opioids following cannabis initiation. While this hearing is related to adult use dispensaries, allowing adult use dispensaries reduces the stigma around folks accessing marijuana for medicinal purposes and increases access for those who could benefit from it within or outside of the medical program. And finally, the data around road safety after adult use legalization is inconsistent, with some studies published showing a slight uptick in the number of car accidents, while other studies show no changes. What we do know is folks are already consuming cannabis and driving, so rather than taking an abstinence-only approach, again, we need to be taking a harm reduction approach and educate adults about responsible cannabis consumption, like we do with alcohol and prescription medications, which includes knowing when you shouldn't drive. But opting out of adult use dispensaries will not keep cannabis out of your community. It will only make it so the cannabis that predominantly remains in your community is untaxed and far more easily accessible to youth. Thank you for your time, and I urge you to vote no when deciding if Irondequoit should opt out.
Thank you. Kurt? State your last name, Kurt. Thank you.
Thank you. My name is Kurt Sieber. I live at 150 Nob Hill. I've been a resident of Irondequoit for over 30 years. And I'm here to express my support for opting out of dispensaries and places to consume. Quite simply for the following reason. Not everything that's legal is beneficial to a community. Most of the arguments surround tax revenues. However, I've spent well over 20 years doing volunteer work at Teen Challenge of Greater Rochester, which is a program that is intake for alcohol and drug addicted individuals. And one of the things that concerns me about the fact that we already have legal cannabis is that I've seen in the 20 years that I've worked in this area that easy access in the community and in a family environment, it basically opens the door for abuse to the most susceptible of the individuals in our community, those adults as well as children or teenagers and youth that might actually be susceptible to serious addiction. In the time that I have worked and talked with hundreds of young men actually whose lives have been destroyed, without question, I've seen a pattern that access to addictive substances in the family environment, the easier that access is, the higher the probability is that addictive behavior can emerge. And so I am opposed to having dispensaries in our community for the reason that it affects the most susceptible individuals in our community. I understand that things are already legal, but I see no reason to further open the door in our community and bring it right to the doorstep. Thank you.
Okay, thank you, Kurt. Sarah?
Hello, my name is Sarah Savage. I live at 81 Party Road in Irondequoit. I don't have any notes prepared. I wasn't thinking about very well-researched stuff like my friends before me. But I just wanted to come up as a resident and as a young person. I know that the demographic in Irondequoit tends to skew older than I am. I'm 33. I grew up in Shiloh. And I grew up thinking that people who use drugs were wrong or bad or that they had problems. And the reality of that is that we have been fed a lot of misinformation about marijuana through the years, about who uses marijuana. And if you look at prisons right now, you can see who is the most criminalized for using marijuana. We know that it's not white people. We know that people who are black and brown have been overly criminalized for these activities, and we know that it's not right. Now we're taking steps as a state to address those things that have happened and to hopefully right some wrongs that have happened through the years. And part of that is using marijuana and using the revenue from marijuana to help address some of the social inequities that we have in our society and to hopefully address some of those wrongs. I hope that we as a town can move forward and not just be stuck in the past thinking the way that we used to think, but we can take this new information and learn something new. And I just wanted to say that as a mom of a young person, I hope that through my modeling and through the modeling of other adults that she will see responsible use, and having legal and safe and regulated use will show her a good model of what both maybe marijuana could look like or alcohol could look like, so that she will not be a substance abuser in the future. Thank you for your time.
Hey, Sarah, thank you. Howie?
Thank you for allowing me to speak today. My name is Howard Revens. I grew up at 170 Nob Hill. I'm a graduate of West Irondequoit High School. I served 5 years in the Marine Corps and have since returned home to finish my master's degree and intend to raise my family here in my hometown community. I'd like to use this time to dispel some myths and common beliefs about cannabis use, which many of the residents behind me have already done so well, so I'll just focus on a few that I think are important. As we've already said, cannabis legalization is not associated with higher adolescent consumptions. The Journal of American Medical Association, as well as the National Center for Education Statistics, have each published separate reviews of cannabis use in adolescents over a 10-year period and did not find a significant increase. Cannabis use is not a gateway drug, as many studies have already dispelled. But what I'd like to point out is a study published by the NIH, which found that alcohol is the most commonly used substance, and that the majority of those with a history of polysubstance abuse have consumed alcohol prior to tobacco or cannabis, which would suggest that alcohol is one of the most widely accepted drugs, is the true gateway drug. Driving while impaired obviously has been on the forefront of many people's minds, and rightfully so. More than one study has found increases in as much as 4% of motor vehicle accidents following legalization. However, I'd like to point out that according to the American Journal of Public Health, they have found no statistical difference in motor vehicle fatality rates. I'd also like to note that a study posted in the American Surgeon, which reviewed data collected at trauma centers across multiple states, found that in Texas there was actually a higher likelihood of finding THC in patients admitted with motor vehicle accidents, despite the fact that cannabis remains illegal in that state. Access for minors is higher with legalization is another concern for the community. Disposable THC cartridges are among one of the most common ways that adolescent teens are using cannabis today, and this trend was present long before New York State decided to legalize. Dispensaries are at least a year away from opening, and yet teens still have access to these black market products, which again begs the question, how does prohibiting legal sales make any impact on curbing this trend, seeing that this trend is occurring without the presence of legal sales? I have been to multiple dispensaries in 2 different states, and my ID was checked 3 different times and entered into a database, which is far more scrutinizing than I think any one of us have ever experienced at any liquor store or gas station buying tobacco. I understand that many who are here today come with concerns for opting in because they care about their children and families, because they care about their communities, and because they want them to feel safe and secure. In just the last few years, Irondequoit Beer Company has become one of the most popular and proud establishments of our town, and I too support that sentiment. More than serving just good beer and good food, it has become a place that so many in our community use as a place to gather, share a meal, laughs, and memories, and has become a staple of Irondequoit and something that many of us are proud of. I ask you to consider how it would be any different if instead of a beer, you'd be served a cannabis-infused treat, drink, or joint. The town of Gates cited the safety of their residents. However, the data does not suggest that legalization or local sales will have any impact on the safety of adolescents, and at very least suggests that prohibiting sales or use is ineffective at slowing any of these trends. If it were truly about the safety, then we would have seen these very same contentious debates every time a liquor license was applied for, especially when they are proposed within close proximity to schools or places of worship, as said by Gatestown Supervisor Cosmo Guinta. But for some reason, the drug known as alcohol doesn't get a second look. How many bars are within less than a quarter mile of West Irondequoit High School? IBC, Old Murph's, Titus Tavern, and the I-Square Rooftop Bar come to mind without much effort, and there are many more examples throughout Irondequoit, not to mention the beloved beer tent set up every summer here at the Town Hall, where parents come by the dozens, often with their kids who are left to roam with their friends while they consume drugs in liquid form. I struggle to find the sense behind arguing in favor of any and all things alcohol, but arguing against cannabis, citing danger and risk to our children. To endorse alcohol and question cannabis is hypocritical or ignorant at the very least. As I mentioned, I served this country honorably for 5 years, achieved the rank of sergeant in that time, and am now top of my class in college. Of course, I did not use cannabis during my service. However, I say this to demonstrate that cannabis users are overwhelmingly not the stereotypical burnouts who sit at home contributing nothing to society. Cannabis users are the owners of your local small businesses, as we've already seen tonight. They are your helping hand at Wegmans. They are your friendly neighbor. And now that people don't have to fear for losing their job because of a plant, it won't be long before you find out that they include, and almost have certainly always included, many of our doctors, educators, public servants, and so many more people who we hold as responsible, respectable, and revered leaders and role models in our community. I'll end by saying it's time to break down the stigma associated with cannabis and realize that it is no less normal and should be no less acceptable than enjoying a crisp cold beer while tending to the grill or serving a nice meal. Please consider this when opting into cannabis sales and lounges. Please consider that opting into cannabis sales and lounges will enrich our community, and vote yes on this issue. Thank you for your time and knowledge. Thank you.
Thank you, Howie, and thank you for your service. Tricia Fagan?
Hello, I'm Tricia Fagan. I live at 310 Carl Sam Drive. I have lived in this town for 22 years. I'm not originally from here. I'm originally from the Buffalo area. And I am old enough to remember a city named Niagara Falls, New York, that there was a big proposal to put a casino there. And there was a big discussion. Lots of city people came out. A lot of people were opposed to it for reasons that it would bring riffraff in, undesirables, homeless people would come to the casino, all that. Niagara Falls, New York passed on the casino. You can now stand in the beautiful park of Niagara Falls, New York, and look over and see where the casino went. Niagara Falls, Canada, booming with all their tourism. The Falls View Casino, it's all privately owned. It all dumps tons of revenue into Niagara Falls, Canada. What now Niagara Falls, New York has is a native casino that doesn't nearly dump as many taxes into the city as the privately owned. So the same, I believe, with the dispensaries. I am for opting in. I'm against opting out. This is happening, whether you want it in this town or not. It's already been approved by the state. There's many state regulations. Dispensaries have to jump through hoops to open properly, have many regulations. I have family members who drive 4 hours to go to Massachusetts to spend thousands of dollars in Massachusetts for cannabis products to help them with their anxiety, with their depression, to get them off the prescription pills. This has been going on for a while. And so they'll spend thousands of dollars in Massachusetts, sometimes do a turnaround. It's only 4 hours away. They'll do a turnaround, but they're eating in Massachusetts. They're having a beer in Massachusetts. They're buying souvenirs in Massachusetts. Listen, we live on a great lake. We have an amusement park right down the road. You know, just bring in dispensaries. Have it add to our tax revenue. Like someone just said, you know, have it reduce my $7,500 a year taxes on a house that I purchased for under $100,000. It's unbelievable, the taxes in this town. Bring it in, because guess what? If you don't, you're missing the boat. Missing the boat, because the town of Victor has already opted in. If you don't opt in, everyone around you is going to opt in, and you're going to miss it. So opt in, let them come into all these dilapidated buildings. I actually live in the East Arundecoit School District. That Abbott's on the corner of Culver and Ridge has been empty forever. Let a dispensary come in there. Because guess what? In Massachusetts, these dispensaries are bougie. They are boutiques. They are gorgeous. You just want to walk in just to see the thing. Let people come in and bring in some gorgeous bougie boutiques. You'll just walk through. You don't have to buy anything. Just walk through and gaze at the beauty of it all. They're nice. Opt in. Please do not miss the boat. Opt in. Thank you.
Okay, good, thank you. John Hurls? State your name, I hope I didn't. Okay.
Yes, sir. My name is John Hurst. I live at 28 Fairleigh Drive. I've been a resident of Arundecoit for 61 years. I've gone to schools here. I grew up here. I volunteered for my time in different organizations. Our town needs this, needs the revenue from this. My son, he owns my home right now. He's paying over $5,000 in taxes. That's ridiculous. We should take this in our hands and run with it. I'm for it, and that's it.
Okay, thank you. Debbie Raimondo?
Good evening.
Hi.
I'm Debbie Raimondo, and I reside at 309 Mallard Drive in Arundecoit. I am a registered nurse with over 45 years of experience. I also have a master's degree. Most of my clinical experience has been with pediatrics and adolescents. I have also worked in home care for many years, and I've spent decades in healthcare management and administration. I am wholly in favor of having dispensaries and consuming lounges. I'm not going to even talk about the finances because that's been addressed very well. I'm going to take it from a healthcare perspective. Many, many people rely on marijuana for controlling pain, for controlling nausea, anxiety, and they have had great deals of difficulty obtaining it. To get medical marijuana, you have to have a physician who is certified in prescribing medical marijuana, and there are extremely few of those. I have had experience with severe chronic pain and recommended by my physician that marijuana would help, but he was not able to provide it, nor was I able to find a physician that was certified in providing prescriptions for medical marijuana. I also have lived in Washington during the time in which Washington State, in terms of when they legalized marijuana. And I was extremely impressed at how professional the dispensaries were. Children underage were not able to get into the dispensaries. Not only did you have to show your ID, but they scanned it into a database. The staff in the dispensaries were very educated, very well informed about the different types of marijuana that they had and its uses. And they would consult with people. What is your purpose? What are you looking for? And they would guide you to the correct type of marijuana. it helps control and decrease the amount of marijuana that has been laced with other drugs. It is a quality control. As far as the effects of having legalized marijuana, the Cato Institute, which is a freestanding think tank, has followed this issue for years across all the different states that have legalized it. On both sides, both advocates and opponents have given you all kinds of reasons, things that are going to occur, and what the Cato Institute has found, that most of those are way overstated. That the effects of legalizing marijuana in terms of crime, accidents, usage, have all been very, very minor changes. That effectively, they didn't have real negative effects on the community. So I wholly encourage you to bring this into our community, not only for social reasons, but for medical reasons. Thank you.
Okay, thank you. Zachary? Is it Brock, sir?
Zachary Brooks.
Okay.
Grew up on Oak Ridge Drive, and I reside at 70 Harvington Drive. I am pro opting in. I think a lot of the financial and medical stuff has already been talked about, which kind of stole my thunder. But Irondequoit is a town of progress. We always have been. I don't know if a lot of people know this, but we're one of the first districts to have the urban-suburban program in Rochester. Aside from that, I-Square, what we did at the community center, the library, IBC, the backyard town hall, master plan project, these are all things that we're doing to move forward, to progress as a town. Opting out puts us behind the eight ball. We do not get the benefits of the financial rewards from opting in, but also the social benefits as well. I don't want to see other communities get ahead of us by opting in. I don't want to have us go backwards. We need to go forwards. We need to progress. We need to go forwards. Lastly, I think that the other aspects of the marijuana business, the cultivation, the processing, distribution, delivery, we can have those here in Irondequoit as well. I mean, farms down on the flats, we can support some of the, we used to be a town of farmers here. I mean, aside from IBC where Vercruz used to be, we used to have farms down on the flats. Let's bring some of those things back. Let's take care of some of the abandoned properties that we have, turn some of those industrial sites, some of those commercial sites into processing, into distribution. But lastly, I think I really want to reiterate that we get put behind the eight ball if we opt out. We don't want to have to go through the process of removing a law to get back into to opt back in once we opt back out. That'll put us behind, and I really think that by opting in, it really does do the community a justice and helps us be a progressive community. Thanks for your time.
Thank you. Lexi?
Good evening, Lexi Popovich, 1595 Elmwood Avenue. So as a representative of the Advocacy and Policy Committee for Drug-Free Irondequoit Together, I'm here to help educate on a few points. As an experienced public health advocate, I work in Monroe County with a plethora of drug-free coalitions, municipal leaders, school educators, and health organizations. The impact toward adolescents is worrisome given the 5 years I've worked in tobacco control and have fought how big tobacco has impacted our youth populations, particularly with the skyrocketing rates of e-cigarettes and cartridges, marijuana cartridges. We believe it is imperative that our town carefully, meticulously, and methodically consider all impacts that on-site consumption lounges and retail dispensaries will have on our community. With this said, Drug-Free Irondequoit Together is urging the board to consider at this time the importance of opting out. Our reasonings are the following. There are current delays in our system oversight that has led to some uncertainty from the state. There was a delay in the appointment of members to the Cannabis Control Board and OCM. They are charged with developing regulations for licensing dispensaries and lounges, as well as setting guidelines for home growing of marijuana plants. Final appointments to the Cannabis Control Board and the Office of Cannabis Management were not made until September 2021. That's 6 months after the MRTA became law, and the Cannabis Control Board did not hold their first meeting until October 5th, 2021, which I was in attendance virtually. The delays resulted in the board missing their first statutory requirement. To date, the Cannabis Control Board has issued no guidance on the licensing of retail marijuana businesses at this time. The delayed state guidance has had a direct impact on local government decision-making. Of the municipalities that have made the decision to opt out, they frequently are citing the lack of clarity on licensing requirements and other regulations for marijuana retail businesses. If municipalities agree to allow marijuana dispensaries and on-site consumption lounges in their community, and then they are unhappy with these state regulations that come into play later, then they ultimately can have no recourse and cannot opt out once they have already opted in. Many local municipalities that I am working with and Drug Free Irondequoit is in contact with are all taking a pause in opting out to see what approach will be taken by the state, and will then consider opting in when understanding how retail marijuana operations will be at that time. While working with the plethora of municipal leaders that I am in Monroe County, the common narrative, again, is to first opt out while gathering more information from the state. The delays in the state oversight, again, has led to no guidance on the licensing of these businesses yet, so opting out at this time will allow for a more thoughtful consideration of how our town infrastructure, economy, social structures, and public health may be impacted. A key element to consider, again, is that you will be unable to opt out any time after December 31st. But we may opt in at any time thereafter. Protecting the health and safety of all citizens in this town is imperative. Therefore, gathering all resources and meticulously analyzing all this information before making a decision to opt in will help make the most effective and sound policy decision. As local legislators, we trust your ability to make thorough and well-informed policy decisions for the overall benefit of the community. I would also like to again reiterate that we will not be able to opt out once we have already opted in. So I just want to reiterate that Drug Free Irondequoit Together thinks that's the most important aspect right now, to just gather more information and research at this time, and then consider other factors that could affect the community if that is the direction the board wants to move in. Thank you.
Okay, thank you.
Thank you.
Dana. Ragsdale? Okay, very good, thank you.
Just briefly, I'm Dana Ragsdale. I live at 236 Franklin Road. I've lived in Irondequoit for 27 years. My kids went to IHS and graduated, well, the schools in Irondequoit, and graduated from IHS. And I'm 75 years old, so I'm part of that old demographic there's so much of in Irondequoit. And I feel very strongly that that anything that can be done to encourage the legal, informed use of cannabis is important. So I don't think that the town should opt out. I think they should opt in. And I think having dispensaries where there's a formal, legal, informed environment is so important to have versus purchasing in a informal, uninformed, and illicit or illegal environment. I think that's not a good thing. I was absolutely amazed. My only experience, I've vacationed for decades in the small town of Yarmouth, Nova Scotia, and a town of 10,000 people. And it's my only experience of visiting a dispensary. And there, it's a state liquor store, and the dispensary was at the back of the liquor store. And I walked in, and I saw the marijuana symbol, and I went into the dispensary, and it was just an absolutely wonderful, eye-opening experience to see all this amazing informational material that was provided to consumers. And I had no idea. I just thought it was a wonderful, wonderful thing. And I would like to see that kind of thing allowed in dispensaries in Irondequoit. I agree with all the other things said about revenue and so on, but my main feeling is just, I think it's so important to have safe, informed consumption that's also legal. Thank you.
Thank you. Kevin Keating.
I'm Kevin Keating, residing at 202 Nob Hill. I've been a lifetime resident of Irondequoit, and over the years I've seen a lot of changes. I've seen the demise of a lot of fine institutions here, such as movie theaters, restaurants, various retail, gone to the wayside and be replaced by tattoo parlors, pawn shops, OTB places, and whatnot. I think I am, first of all, for opting out. As what was said earlier, we only get one chance to opt out, but we can always opt in at a later date. And I think by opting out now, we can have a wait and see attitude to see what the other neighboring towns result in if they opt in. I believe that by opting in, by setting up dispensaries and places where people can legally smoke, will lead to higher crime, traffic accidents. I think that it will create more work for our police department in managing what goes on outside of these dispensaries and outside of these smoking facilities. There'll be more accidents, as I said before. And I think that Irondequoit we should make an example by opting out so that it can remain a family-safe community. If we opt in, I think that we're doing a disservice for our young people here and for the families. I've never seen my taxes go down here, and for those that think that these new businesses will lower the taxes, I think they'll be mistaken. Sure, it'll bring in more revenue, but the town will find ways to spend that money. Again, I am for opting out at this time. Thank you.
Okay, Kevin, thank you. Samantha? Samantha?
Hi. Good evening. Thank you for letting me speak this evening. I didn't even really plan on saying anything. I planned on just coming to observe. But after hearing some of the rumblings in the hallway and also after hearing everybody else talk, I decided to go ahead and get up and speak. So, in thinking about it, I don't know how many of you in your younger years, just to sort of address what the concern about, it being available locally and for local consumption. I don't know how many of you remember in your early years driving to Canada so that you could drink. I mean, no offense, but people are going to go where it is. They're not going to wait for it to be here. As it's already been stated time and time again, it's already here. So us being able to regulate it and make rules around it, that's only going to help for it to actually be more regulated and to be safer for our community. So that I feel like is a given. Now, on a personal note, I wanted to say that I'm right now currently going to school online to become a certified ganjier. That's something that I'm hoping to use as a skill here in our community. And I know plenty of other people behind me and beyond are working on their own skills because they want to keep their skills local as well and open up industry and open up opportunities and open up jobs and open up opportunity for more money. And these are all things that are going to be lost to another town over if we don't start now, if we don't get in on the ground floor. I want to use my skills here. I don't want to move. I don't want to go somewhere else just so that I can potentially, be the skilled informant somewhere in another town. So I think it's important to think about it on the employment aspect too, because there's a lot of people ready and raring to go to make money here and to do it responsibly. And I think that's something to consider. So.
Okay, thank you. Okay, with that, I have no other names, but if anybody hasn't spoke, would like to come up, you're more than welcome. Anyone, yeah, come on up, sure. State your name and your address, please.
Hello, I'm Ian Kachinik. I live at 772 Melville Street. I'll be honest, I had something sort of drafted up yesterday, and I forgot it. So, basically, I would like to reiterate some of the points that have been made tonight, which were all very, very well thought out, very good. A lot of people did their research, so that is wonderful. Just to state for the record, I am for opting in. I think it would be very beneficial to the town. Instead of having drugs that are, marijuana that is supposedly laced with other drugs like fentanyl, cocaine, that sort of thing, it offers the town clean processed products that are going to be much safer for us to consume. And, really, it's just about the taxes as well. I think it's a great tax incentive for the town. It's, 3% for the municipality that opts in. And no? Okay. Okay. 4? Oh, I thought it was 1% going to go to the county.
Well, it's 4% to the county, we get 75 of that, so we will get 3%.
Okay, yeah.
And just to clarify,
So people know that.
the 3% will be allocated by the counties in proportion to the number of dispensaries in each locality. So if there's dispensaries in other municipalities, that 3% will get diminished.
Oh, I see.
Okay. Well, still, I believe it's money coming in, and I believe that it'd be good for the town. And that's all I got. Thank you.
Okay, thank you. Is there anyone else who would like to come and speak? Sure, come on up. State your name and address, please.
Hi, my name is Fallon Young. I live at 36 Kenmore Lane in Irondequoit, and I was the Irondequoit High School class of 2021. And I'm coming up here to let you all know that marijuana is in our community, and your young people are consuming it. The majority of my classmates, younger and older, I witnessed consuming marijuana, and I heard talking about consuming marijuana. In fact, I, on a class visit to the county courthouse, actually saw one of my own classmates in drug court because she was in possession of a dab pen, which is a vape-like pen that you use to consume marijuana. So I can safely say that it is in our community and it is being used. But I want to let you know that pushing it out of our community and opting out is only going to intensify the stigma around it, and it's also going to negatively affect our young people. The safest thing we can do as a community is to educate our young people from a young age about a drug like marijuana and how it affects you. I know a lot of people who have made unsafe decisions under the influence because they are not aware of the negative effects of driving high, of making unsafe decisions. I think that pushing it out is only going to make this town unsafe. I know for a fact many, many young people are accessing marijuana from people that they should not be. There are plenty of marijuana dealers in our community, and they are accessible to many young people starting in middle school. I knew children at Dake High School or Dake Middle School that were accessing marijuana and alcohol, and they were doing it in unsafe manners. And so I think that opting out is only going to further the idea that this is something illicit, that it is exciting, that it is going to be kind of a rush for young people to access, and I think that that is not going to benefit our school or young people at all. That's all. Thank you.
Very much. Anyone else? Sure, come on up, sir. State your name and address, please.
Good evening. Patrick Setch. I reside at 159 Kearney Drive. I've been an Arundecoit resident for a little bit over 5 years now. I am the Senior Director of Addiction Services for the University of Rochester Medical Center and the President of the Finger Lakes Consortium of Alcohol and Substance Abuse Service. And I am here to support the town board's decision to opt out. As was previously stated, there is only one chance for the town to opt out. Opting in can happen at any time. And I think it is smart for the town board to opt out with not knowing currently exactly what the regulations are, what the regulations will be. Take the time to make its own decisions for the town of Arundecoit. Take the time to examine and weigh the risk versus the benefits of dispensaries and consumption lounges and any other aspects of this law. And I would like to mention, some of the areas that, require further, examining. Advertisement, and what will be the restrictions around, advertisement? What will be some of the zoning restrictions? With the town having the ability to examine the regulations and make those decisions for itself. I would recommend looking at some of the public safety risks that exist with impaired and drug driving. One of the areas that I would recommend is having drug recognition experts within our first responders or law enforcement agencies that can then respond in situations involving crashes and impacts to the community. I would urge the town board to consult with medical experts, emergency room doctors, and substance use experts on the impact of high potency marijuana. There is ample evidence there of emergency room visits that are the result of the impact of high potency THC products. I would urge the town to examine, we have plenty of examples of other states and other towns and cities where this has been implemented. What have been the impact to those communities? There are a lot of benefits that are being stated. What is the real evidence of those benefits? The tax benefits, I believe, are overstated. What exactly is the impact to communities that, like Arundecoit, that have already implemented this? We only get the chance to opt out once so that we can take the time as a town to examine and make the best decisions for Arundecoit. Again, you can opt in at any time. You only get one chance. Once December 31st, 2021 passes, the town does not make its own decisions about the implementation of commercialized marijuana. The state does. I would much prefer that the town, in partnership with its residents, is making the decisions for the town of Arundecoit. Thank you.
Thank you. Is there anyone else who would like to speak that hasn't, yeah, come on up. State your name and address, please.
My name is Joanne Waters. I live at 64 Mayville Lane. I've been a resident of Arundecoit for 28 years. I did not grow up here, but it's been a wonderful community to live in. I came and, pardon me, I was doing yard work, so I almost didn't come because I'm a mess. But anyway, I came to learn. I am from a generation, when I was a freshman in high school, our science teacher said, "We're going to talk about drugs." And I was like, drugs? I'm thinking prescription drugs. So that, and I made the choice as a teenager. I've never smoked, I don't consume alcohol, and I've never had any interest in pursuing marijuana or any other substances. It's important to me to be in full control of my faculties. But I've learned a lot tonight. I understand that there are benefits for people who use marijuana. I've heard about anxiety and depression and pain and things like that. And I've heard a lot of statistics. It seems that the number of people who are in favor of opting out are definitely in the minority here tonight. The gentleman who just spoke and others I would concur with. I would hope that the town would take a little more time. I've heard a lot about taxes. I'm a single, self-supporting person. I've been paying taxes here for 28 years. That's not my biggest concern. I wonder, what is the message that we're sending? And I don't know, I heard on the news that Gates, the town of Gates has opted out, but they didn't say what their rationale or reasoning was. But if we can opt out, learn more about this, have more discussion, and then opt in at a later time. Before I'm an RN. I'm a change of career RN. I actually graduated from SUNY Delhi. The School of Nursing there has been designated by the National League of Nursing as a Center of Excellence in Nursing Education. It is with Johns Hopkins School of Nursing and Duke University, according to the article I read. I started in a class of 90 to 110. I was the second oldest person in my class because my jacket says Chase, but there's no more Chase and very little of a Chase left in Rochester, downtown. So I had to change careers. There were between 90 and 110 who started in my class. There were 35 of us who graduated at the end of 2 years. I graduated summa cum laude at the top of my class, and I've had a lot of cornea transplants. That's another whole issue, so it was a real challenge. I've had many challenges in my life. I have managed to transcend. I've had to learn about transcendence, and I have managed to transcend those challenges. I'm going to leave you with two things. One is I have a nephew, very bright, extremely bright, had very significant jobs in New York City. Started consuming alcohol as a teenager, became addicted, then some drugs got involved. He's still dealing with all of that, and he's in his mid-50s, and it has impacted his ability to have a career. He had a very good career going, too. And I'm going to leave you with one of my most enduring memories. And by the way, I have a question. My understanding, I wonder about law enforcement. Is there a way of, when you pull someone over, of determining what the level of THC is in their bloodstream? My understanding is we don't have that capability right now. And I've heard that the number of accidents, statistics, are favorable for, what's being proposed. But if you're in that 4% or whatever of accidents that occur, so this is my enduring memory. I grew up in the Thousand Islands. If you haven't ever been there, it's one of God's great garden spots. Alexandria Bay, I was I think in 4th grade. And actually it was 3rd grade. There was a girl in my Sunday school. She was in 7th grade. I thought she was just it. I was at that age where, there's like somebody and you want to be like them. She was invited to go to a birthday party for her good friend, with her good friend. Her name was Susan Dankoff. And her good friend, Candy Hansen, was in 6th grade. And Candy's mother took Susan and Candy's brothers out to a drive-thru, and then they were going to go to a movie. And as they were pulling out onto Route 12 in Alexandria Bay from a gas station, in a station wagon back then that was very long, big and heavy, they were broadsided by a man driving, they figured, at 90 miles an hour. He had a number of empty beer cans, bottles, whatever, in the back of his car. And Candy was instantly killed and Susan died later. I've never forgotten it. It's one of my enduring memories. I would just urge us, I would hope that we would consider opting out until I haven't heard anything about from law enforcement. I'd be interested to know what the rationale was for the town of Gates, et cetera. So I'm right now not all that favor in opting in until we can, give this some more thought.
Okay, thank you. Thank you. Is there anyone that hasn't spoken that'd like to speak? Come on up. State your name and address, please.
Hi, my name's Rachel Levy, and I live in the South Wedge. And I just wanted to say, I'm really sorry. I was an alcoholic, and cannabis has saved my life. And for that reason, I am looking into getting licensed. And what I have spoken with all of my lawyers is if we don't do it now, if it's not the first people, you're going to lose out potentially. So I just wanted to let you know that that whole wait and see could have some bad effects for your residents who are looking to get licensed. Thank you.
Okay, thank you. Is there anyone else that would like to speak? Sure, come on up.
Hello, my name is Jeremy McGuire. I live at 15 Ridgewood Drive in Irondequoit. And I just wanted to say that I do not support opting out, and for all of the reasons that everyone else already said. That's it.
Okay, thank you. Is there anyone else? Sir, come on up, sir. Oh, come on up.
How you doing? My name is Mark Gonzalez. I'm the operator of Rock Cannabis Collective, 2562 Putnam Road, Ontario, New York. So definitely don't really have a big dog in this race, but I just wanted to know a lot of positive things were said, and I just wanted to emphasize that I think the impact, economic equity and economic inclusion, which I think is very, very important, something that was written into this regulation, can't be forgotten during these opportunities. An opportunity to finally do something for the men and women who've been disproportionately impacted by the war on drugs, to give them an opportunity, to have an opportunity to give that to the people who are struggling, who for years have been arrested and been persecuted by the prohibitions of cannabis, to give them opportunities to own businesses, to have a claim and a stake is real important. And I speak from personal experience. I've been successful. I'm a health and safety consultant. I've been very well and blessed in my opportunity, but I'm also an ex-offender. I was in prison since the age of 16. I came home at the age of 35. And despite all my successes going back out there, it's always going to be held against me that I'm a former offender. This cannabis industry is not going to do that. It's going to give those people who've been persecuted an opportunity to do something for it, and I'm all for it. And I think that that should be considered as well. Just to close up, we're offering opportunities for people. Your next cannabis business owner, if I have my way, they're going to be properly trained, properly successful. We're offering serve safe training programs for people that are making edibles. We're offering OSHA safety trainings for people who are getting into this industry. So, you're opening a door for more than just, economic improvements and taxes, but an opportunity for real ownership for people who felt that they've just been iced out in this game for way too long. So thank you, and I hope you do really, really consider opting in.
Okay, thank you. For anyone else, sir, you'd like to speak, please? Your name and address?
Hi, thank you. Matt Simpson, 37 Westbourne Road. For the people that are concerned about the public safety aspect of legalizing marijuana, I would encourage you to look at the history of other prohibitions in our country and realize that when you criminalize something that is not a crime, you create real criminals. So please make the right decision and bring this from the black market into the legal, safe, taxed, and regulated market. Thank you.
Okay, thank you. Anyone else would like to speak? Anyone else? Come on up one more time. Sure.
Just very quickly.
Okay.
Our country has been involved in this quote-unquote war on drugs for 60 years. To no avail. Drug problem has just gotten worse and worse. It's time we do something different. And by having legal ways and controlled ways of providing marijuana, that's going to take some of the criminal element out of it.
Okay, thank you.
Ma'am, would you mind stating your name for the record?
Debbie Raimondo.
Okay, well, first and foremost, I want to thank everyone. Public hearings really educate us quite a bit to get an idea what the community is thinking. We have quite a few people here, which is very good. I guess it took marijuana conversation to get everybody here. Maybe we'll have to talk about it more often to get you here. So really, I want to thank everyone for your comments. None of us will take it very lightly. We're going to be, how do you want to proceed now on this? We have some resolutions that we could talk about. So I believe we talked about, obviously, December 31st. So we are how many days out now? We have to be 45 days. Andrew, go ahead, please.
Well, so the Marijuana Taxation and Regulation Act requires that localities adopt a local law opting out by December 31st. It also requires that local law to be subject to what's called a permissive referendum. So if the town board decides to adopt a law, residents would have a 45-day window in which to challenge its adoption by filing a petition. So there is some time pressure. I wouldn't say the board absolutely has to act tonight, but it probably shouldn't wait too much longer before making a decision.
Okay.
Andrew, I have a quick question. Do we need to close this public?
That's really a stupid train. I think a motion to close the hearing would be good right now.
I make a motion to close the hearing.
I got a motion to close the hearing.
Second.
I got a second. All in favor?
Aye.
Aye. Opposed? So carried.
I would like to make another motion. I would like to make a motion that we opt into retail distillery sales in the town of Roanoke.
I don't want to speak for the board, but you don't have to opt in. The legislation applies on opt-in by default, so if the board doesn't act at all, no action is necessary. The town would be allowed to have retail dispensaries and on-site consumption licenses.
I understand that, Andrew, but we have had overwhelming testimony, and I think it will only be proper for us to reward that testimony by doing a motion.
Well, I think we have three options. Don't do anything, then it'll be, we allow dispensaries and on-site consumption, right?
That's right.
Or do just dispensaries or opt out completely.
So why don't we
So-
We have a
do that
motion
at
on
our
the floor,
town board
don't we?
meeting?
We
Yeah,
don't
let's
We have a motion on the floor.
let's see if
We don't need
we
that
get
motion.
I'll second that motion.
So we'll need a majority vote. All in
Okay.
favor?
So,
We have to call the
the
vote.
motion on the floor is
To opt into
to
retail
opt into dispensary. Is it
dispensary.
also on-site consumption?
I'm doing one at a time, so I've only done one.
We got a motion and a second.
Yep.
Just for on dispensaries.
So just, you can call the vote and then,
Yeah, I have a motion and a second. Okay. All in favor?
Aye.
Aye. Opposed? Opposed? Motion is carried.
okay, so the town board could now consider whether it wants to opt out of on-site consumption
Some consumption.
businesses.
I think before we should, somebody want to make a motion?
I make a motion that we opt into on-site consumption.
I'm gonna second that.
Anybody want to? Would you like any discussion? No? So we got a second, we got a motion and a second to also have on-site consumption.
Is there any discussion?
Any discussion?
Call the vote.
I call a vote. I got a motion and a second, so all in favor?
Aye.
Aye. Opposed?
So my advice would be those motions moot, the motions to opt out, and so the town board, my advice would be those motions moot the
Okay.
motions to opt out, so the town board could take a motion to close the meeting.
Close it. So first, before we close, I want to thank everyone here, really. Thank you very much. Like I said, we take public hearings very serious here, and I want to thank everyone here. You've all done your homework, whether which side of the aisle you're on. You were very, very respectful of one another, and we as a town board appreciate that. Don't let marijuana the only reason why you come to the town, okay? All right, thank you. I need a motion to adjourn.
Moved.
Second.
Second.
All in favor? Aye. Opposed? Thank you.